All right. Hopefully we have everybody in here. Oh, fantastic. All right, got 11. How's everybody doing? I'm George. If you don't already know me, this is Joint Effort. And Stephanie and Alyssa will get started in just a few moments. And if you have any questions about the content, please feel free to email me at george@jointeffortexercise.com, and I would be so happy to answer or at least forward the questions over to Alyssa and Stephanie. So hope you enjoy the presentation, and I will let them get into it. We're probably just going to wait a few more minutes for everybody here to just get seated and everything. So just a couple more minutes and we'll get started. Thanks. That's practice what we preach. Wait a couple of minutes. Is it? Yeah, it's fine. Yeah. Good. Just got off the treadmill. Yeah, perfect. How are you? Good to see you. How's everything going? They're torturing you there consistently? Yeah. Okay. Yeah.
Now they're doing a good job.
Good.
Definitely getting better.
Yeah. Absolutely. She's married. She's married, so just yeah. I just said you're married, so don't. Nothing creepy. No. Sit down. All right. Here we go. All right. Go ahead. All right, actually, I'll do a quick intro. Okay, so these are wonderful friends, Alyssa and Stephanie. I've known Stephanie for many years, but they're going to do a presentation called Healthy Aging and Function. It's going to talk about just how to age in a healthy and active way as we promote here at Joint Effort. They are specialists of Guilford. They also have a location called Saybrook. We have two previous patients that are members. We're looking at they're absolutely wonderful. Every aspect of the business is wonderful. So I'll leave it to Stephanie and Alyssa.
Thank you. So my name is Stephanie Meoli. I have been practicing in the field of occupational therapy for about 12 years.
My name is Alyssa Demonte. I've also been an occupational therapist for about 8 years.
So both of us have worked in inpatient and outpatient with a variety of patients. Patients with severe neurological pathologies all the way up to just generalized weaknesses as we age. So we have a big span of tools, or OT tools for treatment. And the purpose of our presentation today, so we have healthy aging and function, which is a really broad topic, but what we want to do is give you some specific information about what that means and how you can look out for signs that you would possibly need to address some of these things. Okay. So, what is OT? So most of you have probably heard of physical in your travels in your lifetime. Some of you may have heard of occupational therapy, but there's a lot of people who don't really know exactly the difference between occupational therapy, which I'll refer to as OT, and physical therapy, which I'll refer to as PT. So physical therapy, as you know, really addresses the biomechanical issues that you're having. So if you're having a knee issue or a back issue, they're going to give you exercises that are going to help reduce your pain or correct the biomechanical deficit so that you can move better, feel better, function better. Occupational therapy is kind of the reverse, where our priority is how you function. So when we look at a patient, first, we're gonna look at what do you wanna do on a daily basis? What do you need to do to consider yourself functional? And we're gonna address those things first. That's our priority. So it may not be always fixing the problem right away. It may be learning how to compensate or figuring out how to modify what you're doing in the short term. But we also kind of get into those corrective exercises as well. So you will see a lot of overlap in OT and PT, and that's where the confusion lies sometimes. But really the priority and focus is what's different. It's that focus on corrective intervention versus that focus on function. And so what is function? Function is whatever it means. Function is whatever you do on a daily basis. It's on an individual basis. Something that I need to do every day may not apply to you. Things that you need to do every day is what makes you functional or non-functional. So that we consider that on a person-to-person basis.
All right, so getting into healthy aging a little bit more. So within our OT practice, something that we focus on is this healthy aging, which is being active in an intentional way. So the goal is creating an environment and opportunities that enable you to do what you value and what you would like to do in your day-to-day life. So it's the process of developing and maintaining the functional ability that enable being at age. So when thinking about healthy aging, it's something that I talk about daily with my clients, and important to them. Some examples are being able to age in place. So staying within your home for as long as you can, as safely as you can, and avoiding anything like an assistive care or a long-term care facility. Being mobile, especially now, I know not today, but the weather is getting nicer. People want to go outside and be on their feet as much as possible. So being able to do that, even if it's with a device like a walker or a cane, but avoiding usage of a wheelchair long-term use like that. Maintaining your independence through the ability to drive, returning to work or maintaining work and whatever capacity you would like to do that. And then being able to participate in recreational tasks of choice, things like hiking, golfing, pickleball, being able to stay active with your children and your grandchildren. These are all important things that my clients bring up and are at the forefront of why we focus on healthy aging. So that we're able to assist in healthy aging through OT services are through three aspects of movement, such as motion, strength, and sensory awareness. Okay. So in terms of motion, that is the act of moving, changing, and maintaining body positions, which are important for the physical ability to do the tasks that you would like to do every day. All of our joints and muscles move in three planes of motion, and more of a rotational movement. All these motions can help you do what you need to do on a daily basis, and our goal is to help you maintain or restore these three planes of motion, so that way you're able to do what you would like to do. Within our clinic, we also have a certified hand therapist, if that's something that interests you or you find a need for, and they specialize in treating injuries specific to the upper extremity. So she's able to provide interventions that will specifically pinpoint dysfunction, restore function, and reverse the pathology of impairments in the shoulder, elbow, hand, and wrist. And while having full range of motion is very important to having safe and effective movements, sometimes after a fall or an injury or some kind of surgery, these motions don't come back to their full capacity. So you may be thinking, now what? What do I do next? And this is where occupational therapy comes into play. So we look at, especially if these loss of motion is impacting things like toileting, dressing, bathing, your ability to get around within the home and the community. That's what really triggers us to then come in and see how we can affect some change. You may consider occupational therapy as we're able to provide education on alternative strategies to be able to complete daily tasks. And some of these alternative strategies are environmental modification. So within your home, changing the environment to make things more accessible, more easily available. Task adaptation, so looking specifically at a task, what we can modify within it at the specific level. Using assistive devices or technology, things like using a rollator, a reacher, a tub bench. There's things like voice recognition systems within your home that can make life just easier and safer all around. And then behavioral modifications. So really just changing the approach to a specific task and maybe seeing how that can affect some change. And I know you guys know all about strengthening here. We do that very well. So when we consider strength within our OT practice, our focus is improving bone density, movement quality, and eccentric control. So the difference between the two, concentric and eccentric, they're two different phases of muscle contraction that happen during movement. So with concentric movement, your muscles are shortening as they contract, and with eccentric movement, they're lengthening, elongating. But both of these movements need to happen in conjunction with each other to allow for safe and effective task movements. Doing too much of one without the control of another can be harmful and can lead to possible injury. So it's something that we focus on, being able to move both through the arc of movement to allow for safe tasks. An example of how you use this is thinking about a sit to stand transfer. So if you're in the sit position and then you're coming to stand against gravity, you're working concentrically to keep yourself up. But then in the opposite realm, when you're standing and you're sitting down now in a controlled manner and you're working with gravity, but not letting yourself just plop down into the chair, you're working on your eccentric control. Big focus for the both of us. So another consideration in terms of strengthening an exercise are open chain versus closed chain exercises. With open chain, the segment that furthest away from the body, either the hand or the foot, is free. It's not touching anything, moving about in space. When we're looking at closed chain, that distal segment is fixed onto the floor or it's fixed onto the wall, and your body is providing resistance against. So that's just a different way to look at exercise, and we place emphasis on closed chain exercises because it promotes weight bearing, which is important for neuromuscular function and that promotion of bone density. Utilizing a combination of open and closed chain exercises are really what's going to bring the full picture back to important function and being able to strengthen the whole body. It allows you to do it in a functional way because you're not just focusing on one area and over the other. Doing that can dismiss the neuromuscular function and sensory awareness, which can limit functional progression. Pass it over to my colleague.
Okay, so basically what Alyssa was saying is just because we have strength doesn't mean we always have the ability to control it. And so there are different things that kind of play into that. But sometimes we have patients who say, okay, I've done my exercises, I feel really strong, but when I go to use them on a functional basis, it's not happening. And so that is what she's talking about with eccentric control. We really work on those kinds of things where we put you in those functional movements and situations and teach you strategies on how to facilitate a concentric and fluid movement into eccentric. So we'll get into some of those exercises a little bit after. But a big point that we work on is sensory awareness. So I think a lot of people really understand motion. I have it, I don't. A lot of people understand strength. These are more like general things, but as OT, sensory awareness is another huge piece of aging healthy and staying in place. So one of the main things that we work on is proprioception. So proprioception is our body's awareness in space. So it's a sense that we have that we know where we're gonna put our body, where our body is. So why is proprioception so important? It is one of the three systems that makes up your balance. So we have our visual perceptual system, our vestibular system, and our proprioceptive awareness system. Those three systems keep us balanced and upright. If you remove one of those systems, the other ones have to work harder. So things where this may come into play, where you may notice, we've had patients say, hey, I was in the shower and I was washing my hair and I closed my eyes not to get soap in it and I fall into the wall. Okay. And the other systems are forced to work harder. Training, different exercises. Some people will say, I'm walking fine straight, but when I turn quickly, oh. Well, that's because if you have any delay in your visual tracking and you're taking your visual system away even for a second and your other systems aren't strong enough to compensate for that, then you're gonna have a loss of balance. Shirt over the head. There's a million functional instances where this could come up, where you could notice that maybe this one of your systems is not properly compensating for the other one lacking. So how to improve proprioceptive training is sorry, I lost my place. So we talked about quick direction changes and the other systems having to work. So patients will say to me when we're doing things like we'll work with eyes closed and try to do functional tasks or movement patterns with your eyes closed. And they say, hey, I don't walk around with my eyes closed. Why do I need to do this? And it's just like anything else. When you're isolating out a muscle or a motion, you have to kind of put it on demand. So we will put that on demand so that we can get it, give it the ability to compensate when we lose another system. Okay. So this gets us into motor planning. So when talking about motor planning, we need to talk about the motor loop. So the motor loop is a neural circuit within the brain that's required for planning and executing movements. So as part of what we do is a comprehensive assessment of where in the loop kind of the pathology lies. And based on where those deficits are, we would have individualized interventions to address them. So some people have a pathology in their cerebellar area of their motor loop. So that means their movements are going to be really uncoordinated and ataxic, we call it. So we would have different interventions for something like that. Another one would be an issue in the motor cortex. That's going to affect your ability to plan and execute movements. So we need to look at what that, if that is where the deficit lies, and provide interventions based on that. So why this is important is a lot of people will come to us with issues with step accuracy. So we'll say, okay, I know that I'm wanting to put my foot here. I'm wanting to step up on a curb, but it's just not happening. I'm missing the curb. I see it. I'm trying to plan it. It's not happening the way that I want it to happen. It comes into function when you say, hey, I'm going to go reach for a carton of milk. You have to plan, execute how far you have to put your hand, squeeze the milk carton, move it around. So these are kinds of things that come into play functionally when there's a deficit in that motor loop. And there doesn't have to be a huge trauma. It could just be over time, our sensory systems, just like our muscles and everything else, they kind of degenerate, and that's normal. People say, well, what happened to me that I can't close my eyes and do these things? Nothing. It could just be as we age, all of our systems kind of slow down a little bit, and there are exercises just like for strength and just like for motion that we can do to kind of challenge these systems and improve them. Okay. So another one thing we can think about is the functional application of these. So these are big things that we see people coming from the community with issues. Functional mobility to us is like gait or walking. Uneven terrain, trails, sand, sidewalk, curbs, and stair management. These are the big like functional things that people are saying, hey, I was on the sand the other day and I'm like really having a hard time. And it could be, we have to take a look, like, is it mechanical? Is it the way your ankles are working? Is it your step accuracy or your motor planning? Is it your just overall body awareness in space? So based on the assessment of these items, we can provide individualized interventions to address them. Another thing that we work on is writing reaction or stepping reaction. So sometimes these systems take time, just like strength, just like everything else, to return. So a lot of our training starts, like we said, functional safety starts with how do you react when you have a misstep? How do you react when you have a loss of balance? And that is the forefront of what we're doing, is how do we get you as safe as possible today so that you can go out in the world, and we'll work on these other things as we go. People seem to have a fairly quick response with these proprioceptive training exercises, but for you to be safe, we want it to happen immediately. So we kind of have to work within that compensatory realm of giving you these strategies on how to be safe, but also kind of getting to the root cause of the problem sensory-wise. So I'm going to show you a couple exercises just for each thing that we kind of work on. So we Alyssa's gonna be our patient for today. So this is just a regular like thick mat, and we do like, I'll put all kinds of crazy stuff under there to try to mimic like outdoor terrain. So this is where people really have a hard time in the grass, hiking, sand, those kinds of things. That uneven surface requires a lot of motion, movement, stability, and sensory awareness. So we could do 1,000 exercises on this mat, and it just of those systems. So one we'll do is, this is for like a writing reaction or like a stepping reaction. It's like, okay, if I lose my balance, what do I do? So I'll have to say, Alyssa, push into my hands, push as hard as you can, push, push, push. Oh, whoa, okay. Maybe that wasn't a graceful reaction, but she didn't fall. So I'll say, okay, this time, when you feel yourself start to fall, step and try to control into it. And we're actually like in a way simulating fall and practicing falling in a controlled manner. On a patient, I usually have a gait belt, or sometimes we'll be in between two tables. So the important part is to challenge your patient as much as you possibly can in the safest way possible, where they can't do that at home. Like I can't say like, your husband or wife, okay, push and then let go. We can't do that. You might want to, but we can't. So don't trust falls at home. So in outpatient, people say, I want to practice things at home. So we would work like more like strength, stability, motion at home. But these types of things we simulate in a controlled atmosphere so that you have the proper things. So I'm going to say, okay, Alyssa, as you step next time, try to get your heel down first and try to control and go as slow as you possibly can. And push into my hands, push, 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 push. Okay. And she's a graceful ballerina. And then we'll turn around. We do the same thing. Push, 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 push. Okay, good. Okay, so the idea is we do this over and over again. And so you get like motor memory with it, basically. So the idea is not only to grasp the concept of eccentric control, because now I'm forcing you to do it, but also it's like motor memory, okay? Like now when I'm going forward, I know how to do it, and I know how to control my movements not to fall. And then we were going to talk about some stands here. So the other thing to consider with eccentric control is even if we have it and it's not lacking in some way, we have to consider momentum. Momentum comes into play a lot during function. So if you stand up, you're staying in the waiting room for a long time, and you know they're waiting for you over there, okay, I'm ready for you, and you stand up and start walking. So now we have momentum coming into play. So we'll do exercises like, okay, I want you to stand up without stopping and step over something. So quick, and have to stop yourself there, which seems like an easy task, but when you have gravity and ground force reaction and momentum, it's very hard to kind of stop yourself there. So these kinds of activities are unique from generalized strengthening because they require all of these symptoms, all of these sensory issues, strength issues, motion issues. So we're kind of able to address those with like one exercise.
Yeah.
Right?
So as we say, it's whole body movement.
Yep.
And a lot of these exercises, we're working on your strength, we're working on your balance, we're working on your endurance. Even though you may not have a weight in your hand, your whole body is working. Even when we're doing controlled balance exercises, it takes a lot of effort. If we have you on something unstable, something unsteady, maybe we're putting some pressure on you, some resistance, it takes a lot of control throughout your whole body. So it is just a different kind of way of looking at staying active, working your whole body, just in a different environment.
And we really try to do like building. So we could do is just, we're gonna just do sit to stand, and I want you to control. Okay, now we're gonna stand and step. Okay, we're gonna stand and step. Okay, we're succeeding with standing and stepping. Now I'm gonna have you stand up really quick and have a big step. Okay, then I'll put an obstacle and say step over it now. So these are our way to control the parameters of the exercise and to give you success at each stage, but also keep building upon that so that it could play out in function. Even like curb training, we have a little curb thing, and you practice kind of like, okay, stepping up, stepping down, stepping up, stepping down. when we step off a curb and we're walking, right? So that's a completely different thing that's required for us, is there's now momentum involved, and now we're moving in this plane of motion pretty quickly off of a curb downward, even with a decline. So we try to simulate functional movement the way it would play out in reality, so that motor-wise, we will have that memory and we will have that control.
Also in an individualized way.
Yep.
I find so many times within the session, maybe you have a plan of what you're gonna do with somebody, and then they bring up a point that they wanna work on. Somebody comes in and you're saying, I wanna get back to gardening. So we work on getting down onto the floor, being safe, being able to get down into those positions. And then he's able to do what he would like to do in the environment. So it's very collaborative. We have a team approach. Well, anything you would like to do, we want to help you get there.
Yeah, I think healthy aging is really about your priorities and what you want it to be. And we're here to kind of help give you the tools of like what that would entail. One more fun thing we have to show is these are something we use for that motor planning we talked about, and some step accuracy. We could do a variety of things with these, but this is one of our fun gadgets.
Yeah, good way to get creative.
So these kind of like light up and you tap them. So it's a good way to work on. You could work on reaction time, like how quick you can do it. You can work on how accurately you want it to be done. You could say, okay, I want you to do heel, heel, heel. Okay, now I want you to do toe, toe. So there's a variety of things we could do with these to improve your motor planning and step accuracy.
Ready?
Ready?
All right. Count you down.
3, 2, 1. Go ahead.
Oh, that's your turn.
So these are fun things. We could put them all over. We'll put them at different heights. We could do it to practice action time, like we said, step accuracy, motor planning, scanning. Just something, just something fun. And notice, like we have her on this kind of uneven terrain of sorts. You see her other ankle stabilizing. So not only is she working on motor planning and step accuracy, but now she's working on ankle stabilization as well. So these are the kinds of activities that we like to have that kind of incorporate a lot of things in one. But again, mostly is to directly mimic functional movement patterns. So good job, Alyssa. We'll let that one. So we hope that you have a little bit more specific information about healthy aging, and it's not like the commercialized way that we always think of it, which is like just stay active and keep moving. There is a little bit more to it, and maybe these are not issues for you, but maybe they come into play eventually. And it's good to kind of have that knowledge to say, oh, yeah, I remember when I closed my eyes in the shower and I felt that there might be something there, and there is something to do to help it. So if you guys have any questions, feel free to ask. Oh, yeah, that's fine. But I'll open it up to the floor. Yeah.
How long does it take to see positive results? Always the range.
So that is really like patient specific, pathology specific. So if you have like a neurological pathology or deficit, it takes a long time to kind of affect neural change. With consistent exercise, it is definitely possible, and we do it, but it takes like a longer time. If you have someone who's just like slightly having sensory issues, that could be like a month, a couple times a week for like a month. If you have someone who's had a stroke, that could be a year and a half. It depends on why the issue is happening and how they respond to treatment, how consistent they are.
And do you accept Medicare?
Of course, yes. Yeah, we are insurance-based company. Occupational therapy and physical therapy are both, medical interventions, so they're covered by insurance. Sometimes there's payment situations, just like a doctor's office. Other questions? Yeah.
So for those of us who are coming here on a regular basis and working on our strength, a specific physical whatever that would bring us to an OT.
Right.
what?
That's fine, that's fine.
What do we do? I mean, some of those things are happening.
Right,
You're
So,
saying that
as
there
part of
doesn't need
old
to be,
age.
there doesn't need to be
there
like an
doesn't need,
injury or
you don't need to have a
diagnosis or-
specific diagnosis or injury. You can go to your primary and say, hey, I'm having a hard time with steps, and I think that I would benefit from some balance training. I lose my balance, and they'll write a referral. You could come in without a referral, and they'll tell you like if you need one or not. But you don't have to have a specific fall or incidence. You could just notice this decline in yourself, and we can identify where the issue lies, and that's how we treat it as our like primary diagnosis would be a proprioceptive deficit. That is your primary diagnosis, and it doesn't have to be given by a provider. We can give that diagnosis.
Do you need a prescription for that?
So I think there is situation specific things. So they would tell you when you came in if you would need like a referral, but you don't need like a prescription for like determine the diagnosis, the frequency, and all of that. It would just be like a referral.
Where exactly are you looking?
Do you know where Planet Fitness is? Right across the
Yeah.
street.
You better not.
We're like right across the street. That was a bad. Hey, you know that.
I know there's something else for you.
I'm like trying to figure out what else is over there.
Um,
It's like across the street, one plaza over.
The lake house.
Yeah.
Okay.
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 Actually, quick question.
Yeah.
The evaluation process.
Yeah.
What does that look like?
You just schedule an evaluation.
Okay.
And it's usually about like 45 minutes, and we do a series of questioning and answer. We'll do some like objective testing. We'll run through different functional things like we did today. We'll run through different stances. I'll have you close your eyes. So we're really trying to do an assessment to figure out where the deficit lies and how we're going to go forth with addressing it with intervention. And then we would have a discussion at the end of like what our findings are and what our plan for care would be.
Going back to if we're coming here on a regular basis and don't have those specific things that might bring us to you.
Yeah.
What can we do as we get older and some of those perceptions and everything start going away? What can we do so that individually at home or whatever? Or does
So-
everybody have to go to an OT? I
I-
guess my question is.
So I think that's kind of hard to answer in that I wouldn't know where the deficit would lie to say anything general to give you. I think that if you were a person who practiced your balance, standing on one foot, standing together, close your eyes in a safe, controlled manner, maybe you have a countertop, one foot in front of the other, like those kinds of general things that you can kind of practice. But without kind of having, if you're having these issues, probably do need intervention. Some people are 95 and never lost their balance one time. Like I said, it could just be like a generation over time as we age. But if you do notice it, that it's impacting your function, that's where you would see an occupational therapist. If you're going about your day and you're safe, but you're noticing these little things, you could do training with your, eyes closed, holding a countertop just to see how you do. Practice standing on one foot if that feels safe and controlled for you. Those are pretty much like the safe parameter exercises. But if it starts to impact how you're functioning and your safety, probably it would need intervention.
Yeah, I think Alyssa said earlier, but just like our approach to our strength training here, like everything should be individualized because there's things that there's things that we find in our evaluation processes that like our clients didn't even know was wrong.
Yeah.
Not at all.
Yeah.
So, I think so the vast majority of people probably pay nothing for the evaluation process and even some treatment, I would think, with insurance.
Yeah.
So if you're seeing any decline at all, I would think it would be a really great time investment to just take a look and see.
Yeah.
There's only so much that we can do here from a balance perspective because, as you mentioned earlier, it's mostly on strength and function, things like that. But if there's a really, balance is your number one focus and what you want to improve on, then certainly going above, what we do. And we work so closely with them too, Eric and Paul and Mike and all the guys over there are fantastic from a PT perspective. But the fact that they have OT now is very new, and I think a very just a great service to have right there. So
I could just
Okay.
add that my husband is working with Alyssa. And Ron is,
oh, great.
yeah, he has been for a couple months, right? And he's finding, I mean, he didn't know how much his balance was off. That's the key. You really don't know until you're told, and it's really helped him. He feels much better about it. And so they'll tell you things you can do at home, but it's the stuff there that figures out what you could use. Yeah. And I know that there's no trouble with insurance at all, and he can go to the doctor.
And the fact that it's
That's what I was
individualized too. It's not
What's
like, the fact that it's individualized, so it's not like a
Oh, totally.
group type thing, or
Yeah.
it's a cookie cutter, workout. Like
Yeah.
having something exactly set up for you, where you're at, meeting you where you're at, and then progressing you as you not just that.
It's kind of like here, when you don't, for me anyway, I may not have realized a couple years ago or whatever, that I needed work for strength because I didn't realize I was losing strength.
Right.
And so once I'm here, I certainly can do things that I couldn't do before. For instance, the other day I was you're familiar with the parking lot, but that incline to go up is tough, very tough. And the last couple times that I had gone, I avoided it and walked around, and this time I walked up and I walked down, and without holding on to anything. So I mean, I didn't know that was my problem. That's all.
Awesome.
Yeah, we have lots of patients. Like I had a patient, he was younger too, he was in his 50s, but he had a hard time with the stairs and he was afraid he was gonna have a misstep on the way down. And he
Yeah.
always wanted to hold the rail. And so that was something he wanted to work on. He wanted to go to a baseball stadium with his family and he wanted to work on it. So we just worked on it. We worked on it over and over. That was the most important thing to him. And he said, it was like the best day ever. It was a sunshiny day. I went with my family to, and that's what we those are our happy success stories.
Yeah.
And
the confidence that you provide to
Yeah.
just the ability to continue to do stuff. That's a perfect example. So.
Yeah, and he's not having to worry about it. Because I always used to have to think of where my foot was going to be. And now it happens naturally. So we try to use those phases of skill acquisition of like, okay, we're going to move really intentionally for a while. We're going to talk through it and you're going to be very intentional the way you move. And then we practice it so many times that now it's automatic. Now I can go down the stairs and I don't have to think where my foot is going to land. And that is the goal, is to get from that intentional stage of this isn't safe the way I'm doing it and I need to fix it. And we're going to move with intention to everything being automatic and moving safer.
A personal experience, I think that what the OT or physical therapy does, in order to work, you have to have repetition for a long time and maybe forever. And I think that one way that you could really benefit for the patient is to have communication between what you are doing and the exercise here.
Yes.
Because the programs that we have here, I mean, there is an inclusion of balance exercises.
Right.
But it would be very good if there could be a communication and balance exercise, because that's a reinforcement.
Absolutely.
There.
Yeah, that's absolutely. So part of the joint effort name sounds very cheesy, but
If I
it
could
is
add-
what it is. It's just like communication between other
Absolutely,
healthcare providers that can help us to provide a nice smooth transition out of this type of setting and and into what we do more or less.
And they do work together.
Yeah.
I'm not a plant, but I have to say that for me, I broke my ankle very badly about 1.5 years ago. And my goal was to get back here, was to walk, but also to get back here. And I was seeing Eric, physical therapist over there. And so he would well, actually Bonnie would contact him, they emailed, and would send the information back and forth as to the kinds of exercises that would benefit me at any stage of my recovery, and that's what I would do here with my clipboard. I mean,
And also the
Exactly.
same in physical therapy, sports medicine, when I had my rotator cuff surgery. There was communication. I wanted to get back here, and then when I come, what can I do? And so we talk back and forth.
Yeah, so we can certainly do that. No issue whatsoever. And that's a benefit too. You can do both at the same time, especially with the OT. Sometimes the PT, actually I shouldn't say that because I'm not 100% sure, but sometimes with PT it's a little hairy in terms of like what you do here and what they do there, but because we don't want them to overlap more or less and be doing too much. I would assume with the PT that we can work more or less at the same time, continue to work on strength, upper body, core, so on and so forth here, and still doing neurological training, balance training, with them that are obviously higher than us with that.
Yeah, so I think that's what I was saying before, like more our home exercise program is more like generalized strength. So I do think that really makes sense. Like we're working more on that sensory awareness piece that is pretty specialized to our profession, but in conjunction with that, generalized exercise and stability is great. It's not something that we necessarily would be addressing if we're addressing these other, deficits. So I think that would be a great pairing. We're not just like doing strength, we're doing more like functional movement, but you need strength for it. So it's a good pairing.
Anybody else? Thank you, ladies.
Yeah. Anytime. If you have anyone that has any other questions, maybe reach out to George after if you think of anything later, and we'll be happy to answer that.
Yeah, I'll send emails later on, and they can just go any questions and go straight to you guys. That works. All right.
I know. We do.
That's okay. You know what?
I could drop some back off.
I may have cards. I may have some. I'll look in the back.
But you said
I will. Yeah, I will.
Yeah. I could drop some off.
Thank you, everybody, for watching.
Thank you.
Again, any questions, just email George at jointeffortexercise.com, and I would be happy to help. Hope you enjoyed it.